What's up, Navigating Academia family? This is your buddy and personal academic mentor teaching you how to be able to get into your dream programs when it comes to psychology, so clinical psych PhDs or PsyDs, MSW programs, or MA in counseling programs. So let's go ahead and jump right into it today. Today we're going to be discussing something that I've actually never seen a YouTube video about, and this is how many patients do therapists treat over a lifetime. Now, in other videos, I talk about the pros and cons of being a clinician versus a researcher in behavioral health. And in that video, which was filmed actually a couple of years ago now, but it's one of my favorite ones. It's actually one of the most popular ones on the channel. So check it out after you watch this one. I talk about how if you are a researcher, then in the long run, you can arguably impact more individuals, but you will not have the pleasure of that one-on-one connection with clients, seeing people change close up. You're likely going to be in the ivory tower, in a research department, at an R1 or an R2 university, drilling away on statistical analytic tables and so forth. I know that because I was a tenured full professor, right? So I get that and I understand how it goes. Okay, so let's go ahead and talk about this. So here's the way that I calculated this. I said, okay, so how long is the average career in one of the behavioral health sciences? It's about 40 years or so. So let's say that you end up getting clinically licensed between 25 to 30 years of age. Okay, so this is assuming you're going to work full-time until you're about 65 to 70 years old. Obviously, I know some amazing therapists who have worked for longer, and some people who have worked for less time as well. So then I took a look at some statistics for us, all right, for this video. The first thing I took a look at is the average caseload, which is considered a full caseload. Now, again, this is considered a full caseload, meaning that you are going balls to the wall. Every one of your hours is basically taken during the week. And this total number of clients is 25 clients, okay? And really, that's quite a few. This is assuming that you basically are doing nothing but sessions with different clients almost every hour, because the remaining 10 to 15 hours to be able to get to that average 40-hour work week, you're going to be dealing with things like paperwork, administrative tasks, paying bills, so on and so forth. Okay? And then the average length of therapy for an individual client is approximately 3 months. And so this means that if we have a 40-year career, average caseload of 25 clients at a time, the average length of therapy for each of them is 3 months. This means that if you're seeing 100 clients per year, then over the course of that 40-year career, you will have impacted in terms of giving therapy to 4,000 clients. Now, this is obviously a very rough back of the envelope estimate. You're going to have some clients who stay with you for 6 months or years even. And you also may be in a situation where you don't want to work 40 hours a week. You want to work more hours, or you have family obligations and you want to work less hours. That's fine. This is a general back of the envelope estimate here. Now, here's what I also looked up. So the average household size, at least in the United States, is 3 individuals, okay? So that means yourself and then 2 other people, okay? And then the average number of friends, close friends that people have is 3 to 5. So let's be generous here and say 5. So at the end of the day here, we are impacting a minimum of 7 close individuals in the lives of each one of those 4,000 clients. So at the end of the day, our work is touching at a very minimum in terms of, this is assuming we're making positive differences in these people's lives, but you're going to be impacting in a positive way, hopefully, at least 28,000 individuals. And obviously, you know what I always say is that every person knows 10 people, right? So let's go ahead and extrapolate out from there. So this means that you are positively impacting over 250,000 people, right, just because of your work in terms of being a therapist. And to me, that's pretty amazing. That's pretty great. Now, if you're not a therapist, let's say you're doing research on therapy, I want you to take into consideration that any of the work that you publish, if it ends up helping one therapist to be able to do their work more effectively, then that means that for each one of those different therapists, you can basically say, okay, if each therapist is helping over 250,000 people, if you end up, let's say, coming up with a new evidence-based technique or method or measure, right, anything like this, you can be helping millions of people. But again, indirectly, very rarely are researchers going to be doing also a sizable amount of clinical work. In many cases, people decide to do a little bit of research and a little bit of clinical work, sometimes a little bit of teaching as well. But again, we're talking about here cases where people are 100% of their professional time doing therapeutic work. So I hope you enjoyed that video and found it interesting. Again, we're painting with a really broad brush here, but I've never seen a video even attempt to do anything like this, so I hope you enjoyed it. Make sure to share this video with your friends, colleagues, and students, subscribe to the channel, and like this video too. Thanks so much. I'll see you in the next one. Peace.